is also very important to allow the siblings to be involved with patient care if they are around the sibling during hospitalization. This could come in forms of helping with dressing changes by handing supplies, or helping with distraction during a procedure such as an IV placement, or even helping dispense medicine, like give them the vial that they can squirt in their mouth, or give them the pill so that they can take it. It all depends on the situation, but just try to find ways that they can help with that medical problem. And also, if they aren't there, maybe give them different household activities that they can do at home to help, and explain to them that that in the long run is helping the family as a whole while their sibling is in the hospital. Also, if it is possible, have the parents bring the siblings to the hospital. That's very important, and it's going to help with the overall coping of the sibling. Also, be open and honest with the sibling. If the sibling asks the parent something, they need to be willing to be honest with them, because in the long run that's going to help them cope in the overall experience. Try to keep a routine as much as possible. We talked about earlier, routines are very important and fundamental for younger kids, but even older kids. If you can keep a routine, even though it might alter and change, if you keep some sort of routine, that is going to help. And also, provide some one-on-one time. If you have a patient who's in the hospital, just have them, or have the siblings have one-on-one time with the parent. Maybe the child life specialist steps in and watches the patient while the sibling and parent have one-on-one time. Now, ways that we can help as a medical staff, teach siblings about the illness. That's a big goal in the child life community, is to make sure that not only the patient understands their illness, but also the siblings. Prepare the siblings for any procedures that they will be helping with or that they will witness. So if the sibling is going to be in a room while the patient's getting an IV, make sure they understand what's going on, because that could freak them out as well. So just make sure that they're prepared. Familiarize them with the hospital setting, especially if it's a long-term hospitalization or chronic patient who's going to be coming back. Make sure the siblings are aware of the hospital. It's going to maybe become their second home at some times, so if they feel more comfortable, they're not going to be as stressed out being there. Also, promote visits and engaging activities with each other. So if a sibling is there visiting the patient, get activities together that they can do together to help keep that relationship. Also, provide activities that have emotional outlets. They might have all this emotion and stress and anger pent up, and if they have different activities that they can use to get this out, then that will help them. So overall, we know that we can see from this presentation, from these facts, that sibling involvement is very important in a patient's hospitalization, whether it be for the patient's coping, for the siblings coping, or for the overall family coping. It is very important. Thank you guys for listening today. If you guys have any questions, feel free to grab me and I will answer them as best as I can. Thanks.